Hi everyone, this is a detailed video of mine about Myasthenia Gravis. Well, it is characterized by weakness and rapid fatigue of any of the muscles under your voluntary control. It's caused by a breakdown in the normal communication between nerves and muscles. There is no cure for Myasthenia Gravis, but treatment can help relieve signs and symptoms such as weakness of arm or leg muscles, double vision, drooping eyelids, and difficulties with speech, chewing, swallowing, and breathing. Though this disease can affect people of any age, it's more common in women younger than 40 and in men older than 60. Now, first of all, I'll tell you the symptoms. Muscle weakness caused by myasthenia gravis worsens as the affected muscle is used. Because symptoms usually improve with rest, muscle weakness can come and go. However, the symptoms tend to progress over time, usually reaching their worst within a few years after the onset of the disease. Although myasthenia gravis can affect any of the muscles that you control voluntarily, certain muscle groups are more commonly affected than others. Now I'll tell you about the eye muscles. In more than half of people who develop myasthenia gravis, their first sign and symptoms involve eye problems such as drooping of one or both eyelids, that is known as ptosis, double vision, that is diplopia, which may be horizontal or vertical and improves or resolves when one eye is closed, face and throat muscles. In about 15% of people with myasthenia gravis, the first symptoms involve face and throat muscles, which can impair speaking. Your speech might sound soft or nasal depending on which muscles have been affected, cause difficulty in swallowing. You might choke easily, making it difficult to eat, drink, or take pills. In some cases, liquids you are trying to swallow come out from your nose. After chewing, the muscle used for chewing might tire halfway through a meal, particularly if you have been eating something hard to chew, such as steak. Also, there may be change in facial expression. For example, your smile might look like a snarl. Neck and limb muscles. Myasthenia gravis can also cause weakness in your neck, arms, and legs. Weakness in your legs can affect how you walk. Weak neck muscles make it hard to hold up your head. You should talk to your doctor if you have difficulty in breathing, seeing, swallowing, chewing, walking, and other symptoms which I have just told you. Okay. Now I will tell you the causes. Uh, well, there is the role of antibodies. Your nerves communicate with your muscles by releasing chemicals, which are neurotransmitters that fit precisely into receptor sites on the muscle cell at the nerve-muscle junction. In myasthenia gravis, your immune system produces antibodies that block or destroy many of your muscle's receptor sites for a neurotransmitter called acetylcholine. With fewer receptor sites available, your muscles receive fewer nerve signals, resulting in weakness. Antibodies can also block the function of a protein called muscle-specific receptor tyrosine kinase, sometimes referred to as MUSK, and you can call it MUSK. This protein is involved in forming the nerve-muscle junction. Antibodies against this protein can lead to myasthenia gravis. Antibodies against another protein called lipoprotein-related protein 4, LRP, also abbreviated as LRP4, can play a part in the development of this condition. Other antibodies have been reported in research studies, and the number of antibodies involved will likely expand over time. Some people have myasthenia gravis that is not caused by antibodies blocking acetylcholine, MUSK or LRP4. This type of myasthenia gravis is called seronegative myasthenia gravis or antibody negative myasthenia gravis. In general, researchers assume that these types of myasthenia gravis still have an autoimmune basis, but the antibodies involved are just not detectable yet. And I'll tell you about the role of thymus gland. The thymus gland is part of your immune system situated in the upper chest beneath your breastbone. Researchers believe that the thymus gland triggers or maintains the production of the antibodies that block acetylcholine. Large in infancy, the thymus gland is small in healthy adults. In some adults with myasthenia gravis, however, the thymus gland is abnormally large. Some people with myasthenia gravis also have the tumors of the thymus gland, which are known as thymomas. Usually, thymomas are not cancerous, but they can become cancerous. Now I'll tell you about some other causes. Rarely, mothers with myasthenia gravis have children who are born with myasthenia gravis, which is known as neonatal myasthenia gravis. If treated promptly, children generally recover within 2 months after birth. Some children are born with a rare hereditary form of myasthenia gravis called congenital myasthenic syndrome. Now I'll tell you about the factors that can worsen myasthenia gravis. And these are fatigue, illness or infection, surgery, stress, some medications such as beta blockers, quinidine, gluconate, quinidine sulfate, quinidine, phenytoin, certain anesthetics, and some antibiotics, pregnancy, and menstrual periods. Now I'll tell you about some complications. Well, complications of myasthenia gravis are treatable, but some can be life-threatening. The first is myasthenic crisis. Myasthenic crisis is a life-threatening condition that occurs when the muscles that control breathing become too weak to work. Emergency treatment and mechanical assistance with breathing are needed. Medication and blood filtering therapies help people to again breathe on their own. Thymus gland tumors. Some people with myasthenia gravis have a tumor in the thymus gland, a gland under the breastbone that is involved with the immune system. Most of these tumors are called thymomas are not cancerous. Other disorders. People with myasthenia gravis are more likely to have other conditions such as underactive or overactive thyroid. The thyroid gland, which is in the neck, secretes hormones that regulate your metabolism. If your thyroid is underactive, you might have difficulty dealing with cold, weight gain, and other issues. An overactive thyroid can cause difficulty dealing with heat, weight loss, and other issues. Autoimmune condition. People with myasthenia gravis might be more likely to have autoimmune conditions such as rheumatoid arthritis or lupus. Okay, now I will tell you about the diagnosis. Well, your doctor will review your symptoms and your medical history and conduct a physical examination. Your doctor might use several tests, including neurological examination, such as he will check reflexes, muscle strength, muscle tone, senses of touch and sight, coordination, and balance. Tests to help confirm a diagnosis of myasthenia gravis might include ice bag test. If you have a droopy eyelid, your doctor might place a bag filled with ice on your eyelid. After 2 minutes, your doctor removes the bag and analyzes your droopy eyelid for signs of improvement. Blood analysis. A blood test might reveal the presence of abnormal antibodies that disrupt the receptor sites where nerve impulses signal your muscle to move. Repetitive nerve stimulation. In this nerve conduction study, doctor attach electrode to your skin over the muscle to be tested. Doctor sends small pulses of electricity through the electrode to measure the nerve's ability to send a signal to your muscle. To diagnose myasthenia gravis, doctor will test the nerve repeatedly to see if it is able to send signals worsen with fatigue. Then we can also carry out single fiber electromyography. This test measures the electrical activity traveling between your brain and your muscle. It involves inserting a fine wire electrode through your skin and into a muscle to test a single muscle fiber. Imaging. Your doctor might order a CT scan or MRI to check if there is a tumor or other abnormality in your thymus. Pulmonary function test. These tests evaluate whether your condition is affecting your breathing or not. Okay, now I'll tell you about the treatment. Various treatment alone or in combination can relieve symptoms of myasthenia gravis. Your treatment will depend on your age, how severe your disease is, and how fast it is progressing. Medications. And the first medication is cholinesterase inhibitors. Medications such as pyridostigmine, which come with the name of mestinone, and regonal, enhance communication between nerves and muscles. These medications are not a cure, but they can improve muscle contraction and muscle strength in some people. Possible side effects include gastrointestinal upset, diarrhea, nausea, and excessive salivation and sweating. The second medicine is corticosteroids. Well, corticosteroids such as prednisolone inhibit the immune system, limiting antibody protection. Prolonged use of corticosteroids, however, can lead to serious side effects such as bone thinning, weight gain, diabetes, and increased risk of some infections. Immunosuppression. Your doctor might also prescribe other medications that alter your immune system, such as azathioprine, mycophenolate mofetil, and some other medicine. These drugs, which can take months to work, might be used with corticosteroids. Side effects of immunosuppressants such as increased risk of infection and liver or kidney damage can be serious. Then, in some cases, we might recommend intravenous therapy. The therapy used in short term to treat a certain worsening of symptoms or before surgery or other therapies include plasmapheresis. This procedure uses a filtering process similar to dialysis. Your blood is routed through a machine that removes the antibodies that block transmission of signal from your nerve ending to your muscle receptor sites. However, the good effect usually lasts only a few weeks, and repeated procedure can lead to difficulty accessing veins for the treatment. Risk associated with plasmapheresis include a drop in blood pressure, bleeding, heart rhythm problems, or muscle cramps. Some people develop an allergic reaction to the solution used to replace the plasma. Then we can also do we can also use intravenous immunoglobulin. This therapy provides your body with normal antibody which alter your immune system response. Benefits are usually seen in less than a week and can last 3 to 6 weeks. Side effects, which usually are mild, can include chills, dizziness, headache, and fluid retention. Also, we may recommend monoclonal antibody rituximab that comes with the name rituxan, and the more recently approved eclusizumab uh, are intravenous medication for myasthenia gravis. These drugs are usually used for people who do not respond to other treatments. They can have serious side effects. And then also we can recommend surgery. Well, some people with myasthenia gravis have a tumor in thymus gland. If you have a tumor called a thymoma, doctor will surgically remove your thymus gland, that is known as thymectomy. Well, this can be done as a open surgery or with minimal invasive surgery. Okay. Now I'll tell you about some lifestyle and home remedies to help you make the most of your energy and cope with the symptom of myasthenia gravis. You should adjust your eating routine. Try to eat when you have good muscle strength. Take your time chewing your food and take a break between bites of food. You you might find it easier to eat small meals several times a day. Also, try eating mainly soft food and avoid food that require more chewing, such as raw fruits or vegetables. Use safety precautions at home. Install a grab bath or railing in places where you need support, such as next to the bathtub or next to steps. Keep your floors clean and move area rugs. Outside your home, keep paths sideways and driveway cleared of leaves, snow, and other debris that could cause you to stumble. Use electric appliances and power tools to help you maintain your energy. Try using electric toothbrush, electric can opener, and other electrical tools to perform tasks. Wear an eye patch. If you have double vision, an eye patch can help relieve the problem. Try wearing one to write, read, or watch television. Periodically switch the eye patch to the other eye to help reduce eye strain. Plan. If you have chores, shopping, or errands to do, plan the activity for when you have the most energy. Well, this was my video about myasthenia gravis. I hope you like this video. If you have any question about this condition, please do not forget to post your comments in the comments section. Thanks for watching this video. See you in the next video. Bye for now.